So I'm here with Dr. Anne-Marie Albano, Associate Professor of Clinical Psychology and Psychiatry at Columbia University, and the Director of the Columbia University Clinic for Anxiety and Related Disorders. Thank you very much for being with us.
Thank you.
So today we're going to talk a little bit about depression in children. So my first question is, if a parent is worried about their child's behavior or emotions, how can they find out if their child actually has depression?
Depression is pretty insidious. That is, it's a slow-moving disorder that the child is headed on a downward spiral, and it's hard for parents to notice it. And part of the reason is because the child gets irritable. It's not as simple as adult depression where you withdraw from the world, you're crying all the time, and you take to bed. With children, you see irritability that starts, and a lot of times parents chalk that up to an age or stage that their child is in. So watch for irritability as that moves along. The other thing that starts happening is that depression usually onsets in adolescence. Now, sometimes you have childhood depression, 9 or 10 years of age. And what you're going to see is that your child will stop doing things they used to enjoy doing. Again, you might think, well, he doesn't want to be on the Little League team anymore because he's 12 now. Well, why wouldn't he want to be on the team at 12? They stop engaging in activities that used to bring them pleasure. They get really down in the mouth. Everything is negative. Why should I bother? Nobody cares. And so you see a lot of negativity, and their self-esteem starts to plummet. So they'll make statements that you might hear, I'm not good at anything. So you look at irritability, dropping out and loss of interest and pleasure in activities. You look at statements that, that they feel worthless or not good enough at things. The future won't change. They're kind of hopeless and pessimistic. You see that and might hear that. And of course, the thing we always really worry about and look for is whether they're saying things like, life isn't worth living, why the heck should I bother? Which, get towards when the depression is advancing and kids feel, suicidal. And parents get scared about that. So you'd look for behavioral and emotional changes that are lasting more than a couple weeks, 2 weeks, 3 weeks, 4 weeks. They're not simply a matter of stage and age, all right? And the thing a parent has to do is check with a pediatrician, check with a child psychologist, child psychiatrist, someone who can evaluate what's going on here and help them make a decision about getting some help.
So speaking of getting help, what treatments for depression are evidence-based?
Well, there's good news here in that there are probably 3 solid options, 4 even, for treating depression in youth. So one is a treatment called interpersonal therapy for adolescents, developed by Laura Mufson and Myrna Weissman. And this is a therapy that focuses on addressing the depression, but also in the context of the child living with parents, and caretakers and such. It gives them some skills for communicating and negotiating and things. It's an evidence-based treatment. It's been evaluated in clinical studies and proven to help more kids overcome the depression. The second one is cognitive behavioral therapy. And cognitive behavioral therapy has a long history, actually, different approaches to cognitive behavioral therapy using reinforcement, using cognitive changes, how to address the way you talk to yourself. There's a number of different cognitive behavioral approaches that are developed and help kids overcome depression. And it's done in group or individual or even family-based format. So there's CBT. The third option is medication. And, a lot of parents don't like to hear that, but medication, especially for kids who are moderately to severely depressed, you have to think about the option of medication for addressing this. And I was part of a large study called the Treatments for Adolescents with Depression study that looked at medication, cognitive behavioral therapy, and their combination as compared to pill placebo. And the fourth option for parents is the combination of medication plus CBT or interpersonal therapy, because the combination gave kids the best advantage of getting over their depression.
So, what should a parent's role be in treatment for depression?
The parent has a number of roles. First and foremost is whether it's through struggling or whether it's through honest talking, helping your child to see, look, we've seen a big change. We've got to get you some help. You can't continue this decline. And you might notice grades sliding. You might notice friendships falling apart, all kinds of things. And you could use that to say to your child, whether you really don't want to hang out with your friends, or we'll figure that out later, but right now we think you're depressed or something's going on, we need help. So the parents are number one for getting the kids in, even if it's dragging and kicking. The next thing is the parents are great informants. I don't mean that in a negative way, reporters to the clinician to describe what they've seen, how their child was from early on, how things have changed over time, what they've tried to get their kid to do the things that they used to do or lighten up the mood, what's worked, what hasn't, how the child reacts, the teenager reacts. The parents are very good with reporting and being observers of the behavior. And then the thing is the parents will work with the therapist and the teen or the child to define the goals and will help to send in information if they're not in the sessions in different ways at times, but what they're seeing in terms of progress, because treatment needs feedback. We always need feedback to know if we're making progress in case we need to adjust things in a certain way. I mean, some people will start out with therapy only, psychotherapy only, and if after, for me, it's usually about 4 weeks. If I'm not making good progress, we have to talk about medication or adjusting things, do the treatment twice a week instead of, we have to do things. So the parents are very important in keeping an open mind, getting the kids to therapy, and, engaging in the process of goal setting and feedback.
So you mentioned 4 different treatments that are available.
Available is another term because these are 4 different treatments, right? The combination, medication only, or cognitive behavior therapy or interpersonal therapy. The problem, of course, is finding the right practitioner, someone who knows what they're doing. And I say this with all due respect to a physician who's a child or adolescent psychiatrist, as well as therapists, social workers, psychologists, who know cognitive behavioral or interpersonal therapy. These things are not readily available in every community.
So how does a parent know when their child is receiving appropriate treatment for depression, and evidence-based treatment for depression?
You'll know you're getting an evidence-based treatment if, again, your opinion is valued. And if you and your son or daughter are constantly in the position of giving feedback to the person treating them, or persons, if it's the combination treatment, of how their mood is, how their energy level is, how their activities are going, if you're giving information over the course of time that shows whether things are changing or not. You will also see that your teenager or your child is being taught skills and they've got to practice them. And when it comes to younger kids, a lot of times we ask the parents and we work with the child and parent to work on the skills together. So your child is going to have, or teenager is going to have homework, therapy work that they have to do in between sessions. That is always a part of evidence-based treatment. There's forms and diaries and things that we all have to do, in evidence-based treatment because it's a feedback system of keeping us informed and moving towards goals. And that's the other thing. You'll know it's evidence-based if the therapist is telling you, given the way your child presents, I'm expecting if everybody follows the program, we're going to be doing this in about 12 to 16 sessions. Or if it's a physician, they're going to say, I'm going to expect to see things change over X number of weeks, and you are giving and your kid is giving feedback on that as it moves along.
So some parents might ask, why does my child even have depression? What would you say to a parent and whether that matters for treatment?
Well, that's every parent comes in. They ask the question in a couple of ways. Why does this happen to my child, and what did I do to cause it? And, and they're concerned, and they want their kids to be happy, healthy kids. Well, there's so many factors that are out of the parent's control, first and foremost. There may be biological issues that go back, 2-3 generations to depression that ran through a family, even anxiety that ran through a family. If there's a family history of anxiety or depression, that is one risk factor. Next comes whether the parents themselves are currently or ever had depression, because we do tend to find that depression tends to run in families like this. And there's two things here. One is there's the biological component. Those kids have the genes. It's not your fault, but this is the way it's been handed to you and handed. But the other part to this is then if you're depressed while you're raising your child, the nature of your parenting and the environment that everybody's living in is changed from non-depressed families, right? So the environment plays a role, and parenting approaches play a role, and whether mom or dad are feeling okay and not depressed themselves. So there's a number of things that coalesce, and then you have a child who's growing up, and the way they think about things gets shaped by the environment and by whether they're feeling bad about themselves and so forth. It's a big feedback loop inside of them. And what happens, what's going on there, certainly are things like divorce, changing and moving away from one town to the next, things that might go on. There's all kinds of things in the environment that also can build upon the biological and other things there and make any risk factor, realize that depression occurs. Your child has this because of a multitude of factors. Some we can maybe identify, but some we can't. The important thing is you get them in so we can start now to help teach them ways of managing that will serve them well going forward.
So it's pretty common that, that children who have depression or teens that have depression might also have anxiety as well. How does that change treatment options, and does that complicate treatment?
Well, here's something that's been shown in study after study. Anxiety tends to predate depression. That is, if the child has been separation anxious, or a child has been a worrier, an over-anxious child, or socially anxious, afraid of other people and such, the longer they suffer with those kinds of anxieties and phobias, the more likely is depression will come on in adolescence. So know that. If you see your child is anxious, swoop in then for help. Don't wait until the depression comes on, because they're double whammied. So anxiety tends to co-occur with depression by adolescence, but it's usually an anxiety has been there for the longer term. It makes, for treatment, it depends on how long they've been struggling with it, with these conditions. It depends on how severe they've become and the level of disability that they cause. Are they no longer going to school because of this? Are they, so down that they can't function in any kind of they sort of slog their way through school, but they're not really engaging in life? Do they cry? Is there a lot of distress and upset? All these things are going to go into the determination of what to do and how much and how, quick, and also how involved we have to get to loosen up the depression and anxiety and move forward.
So are there treatment options that you would not recommend to parents seeking help for their child or teen's depression?
Here's the thing I would say, and I have said to parents. There is a window of childhood and adolescence, roughly, that is 21 years in length. A window of opportunity for being a kid, for being a teen, and a college student, let's say. You have after you're in your 20s, you've got decades ahead of you to mess up, reinvent yourself, switch the way you're thinking, work on a problem or not. You've got a lot of time in adulthood to do things. You only have this period of time of childhood and adolescence. It's fixed. You don't get extra time. So my bias is that, first of all, kids should have the treatment that works made available to them. Cognitive behavioral therapy, interpersonal therapy, and when it's necessary, of course, medication in there. They need the treatment that is going to teach them skills that they will use going forward. So only the evidence-based treatments is what I would look for that are typically goal-focused, short-term, and I wouldn't have kids going into therapies that are never-ending, that there's no goal stated, and that parents don't have a clue as to what's going on with their child.
So are there any last tips that you would give to parents who are worried about depression in their children?
Well, I would say seek a consultation. And a lot of times the first place they go would be their family physician. And read. We have on our website, effectivechildtherapy.org or net. I forget which now. But anyway, we have on our website, if you're here, it's our website. You can look. We have a lot of information about depression and other issues with kids. I would get educated in the right way. Don't just read everything, and don't read horror stories. Talk to the professionals, seek out evidence-based treatment, and get in there quickly.
Well, thanks so much for your information and advice today.
Thank you.